A big difference between Italy and Philippines is regarding the healthcare system. But let me explain you better. Buntis, I go out.
Okay.
Another beautiful day dito sa Puerto Princesa, a chill day. I helped Buntis to prepare the grill. We are going to prepare liempo today. I also did some research online and now morning walk to maintain us healthy. You know what I love of living here in the province is that everything runs chill, is a really chill life and you have more time for yourself. Probably when the baby girl will be with us, we'll have more time to spend together instead of the frenetic and stressful life in the city. But the most important factor is for sure that living in the province, you have a really way healthy, more quality life. The healthcare system in Italy is free, while here in the Philippines, we need to pay. And with baby girl that soon will be with us, we need to make sure that our family is secure and protected. And independently of this pandemic, the coronavirus that affecting everybody, included us, but there are two things that we are considering to put in the priorities of our family. First is to build house, because our family will need house where to live. And second is to have an insurance, an HMO that will protect us by emergency and in case anybody of us will get sick. Here we go, and look at here. Buntis is already cooking the liempo. We just made this DIY grill. We take a pod, a grill, and here we go. Malakas and rain. It's actually started to rain Malakas, so we had to move inside. It's a rainy season, so it's quite normal. And now, let's eat. Buon appetito!
Kain na po tayo.
Masarap ang liempo ni Buntis. Finished to wash the plates, now let's go to Buntis. Let's turn off the lights, let's save energy, and let's go to Buntis. Hey baby!
Baby!
What are you doing?
I'm doing something, but let's eat first the dessert. May pasalubong si Gerson. Okay.
Ah yes, the pasalubong ni Gerson.
Palawan nougat.
Oh.
Oh yeah, this is a specialty here in Palawan.
Yeah, and we never tried, diba?
Yes, never. This is the first time. Wild honey and whole cashew nuts.
So this is the Palawan nougat, diba?
See.
Let's open it.
And it doesn't come cheap. So let's see. I think that's it.
Let's try.
Let's try.
Are you sure it's plastic, babe? She was cutting the cut. Yes. You need to open that. Yon, open that. Yes, we figure it out.
That kind of looks weird.
Yes, and it's a bit.
Because
We need to take-
the paper looks.
Yes,
Looks like creamy also.
We never saw this before. Yeah, this is already. Yon.
Yeah. Okay.
Ganon. Okay, guys, it's white, and let's try. You try first, baby, or I will try
You
first.
try it first.
I will try first. It's actually really good, baby. It's sweet, and it's really taste of honey. It's really good. It's really delicious. If you come here in Palawan, look for this. We didn't even actually know. We knew it now for the first time, just because Gerson mentioned it to us. Really masarap. Approve. And what you was doing in the laptop, babe?
I am reading on how we can add our baby as our dependent
Yeah,
in our
HMO.
HMO. Yeah, we're under a family plan.
Yes.
So I'm just trying to figure out the requirements, and eventually we can add her within 15 days.
Okay, that's great.
15 days when she will be
Yeah.
out.
So all the family will be protected with the HMO, right?
See, Yes, and because here in the Philippines, healthcare is not free like
Yeah.
Italy.
And also medyo mahal, because when you go hospitalized in the hospital, become medyo mahal. While in Italy is for free, so you are not really much affected. Here in the Philippines, sometimes
Kailangan
happen.
talaga ng because especially if you get hospitalized,
Yeah.
the bill can
Sobrang
really, get big.
yeah.
And if you're not covered by an HMO, it can really
Yes.
be a big burden.
So we will be protected, right?
Yes. For those of you who do not know, an HMO is a health maintenance organization. Okay.
Yes.
We chose MaxiCare as our HMO. We've been under MaxiCare when we were still working under a company. It's
Yeah.
part of our health benefit being an employee.
And is also by the time that I got the diba? And
Yeah, when Mirco was hospitalized in Makati Med, we didn't pay anything.
Zero.
It was MaxiCare who covered the bill because we're still under the company. But even after we became self-employed, we became freelancers,
we did.
we still continued and opted to go with MaxiCare.
Yep.
Actually, my job really is, I was a company nurse before for more than 5 years, and it's really my job to get proposals from different HMOs and help the company decide to get the best health maintenance organization for the employees as a benefit. And MaxiCare has been consistent. They have very wide range of coverage.
Yeah.
There
are different packages, right?
Now for us, we are under a family plan.
Yeah.
Under a platinum coverage.
Yes, there are different packages. We have to take basically the best. And
second to the most expensive.
Because we'll cover 150,000 per person if something happen. The most expensive will cover you 200,000 and
annual benefit
annual
limit. Okay, so annual benefit limit is what you can use for the whole year.
Yeah.
Of your coverage.
Mm-hmm.
Now, an HMO is every year ito binabayaran.
Yes.
Well, pwede rin namang annual or quarterly.
Yes.
But we chose to pay annually because
it's cheaper. But there is
you can save more.
Yeah. And actually, between me and Buntis, I paid less because I'm more young.
Because he's younger. Yeah, it also depends on the age of the enrollee.
Yes. So also for our baby bell. So also.
He almost said the name.
I almost said, but I will not say. But for our baby girl will be really cheap, probably, right?
That I will have to check.
We need to check, but for sure, yes,
cheap
because
is relative for me. It depends on what's covered. I check these things. So also, I think why we also like MaxiCare is because the coverage is wide, no?
It's wide, yeah.
And also I checked also before kung anong coverage dito sa Palawan, because the more hospitals, the more clinics, the more doctors accredited, the better.
It is, yes.
See?
Also, we have free cleaning for our teeth, to the dentist.
Yes.
We have also coverage for many other things, right?
Basically, the HMO covers consultation.
Yeah.
And you also need, when you choose an HMO, you have to check this because there are packages that only offer clinic-based consultations, meaning you can only go for checkups in clinics outside of the hospitals. Kasi there are clinics also inside the hospitals, diba? But for us, we have both, clinic and hospital-based for our consultation under a package. And then we also have hospitalization, including the room and board.
Yes,
so
we will have our private room, right?
Our plan covers private room. Yung difference nga niya from the plan higher than ours is that it's a large private or presidential suite.
The presidential suite, but not in all the hospital there is, so it doesn't make sense for us.
Especially here in Palawan, I mean.
Dito sa Palawan there is not.
I don't think may nag-offer ng presidential or large private room dito. So it doesn't make sense for us to get the highest package because of the room. Hindi rin naman namin ma-avail yun. So next, we also have dental benefits.
Dental,
Emergency benefits.
yes. Cover dengue, hernia.
Hospitalization yun.
Yeah, okay.
Oo. Meron din kaming coverage for pre-existing conditions, dreaded, non-dreaded.
Yes.
But ano po yun, you have to read talaga the fine lines kung alin at saka magkano per illness.
One thing that actually make me surprised is that almost all the HMO in the Philippines, anyway, they don't cover the pregnancy.
Maternity.
Yes,
Yeah.
maternity is not covered here in the Philippines. So if you get pregnant, you need to cash out always from your pocket. This is something that actually is really weird for me, because in Italy, for pregnant women is totally everything.
You know
free.
why, babe? Because in insurance, pregnancy is not considered an illness.
Yes, it's not considered an illness.
Oo, kaya gano'n. But, may bago ang MaxiCare na they cover naman the first trimester, laboratory and checkups. Pero yung delivery, hindi.
Hindi. Yeah, that actually the delivery is what is expensive.
Also for the consultation, yung mga pre-postnatal. Although for these things, no, talagang kailangan talagang paghandaan ang pagbubuntis. Kasi nga most of the HMOs don't cover pregnancy.
But also makes sense, I think, here, because anyway, are all private hospital, and of course, it's a business for them, so it's part of the game, right? Yeah.
Well, what else? Meron din tayong AD&D, accidental death and dismemberment,
Yes.
na coverage, and international assistance. If ever we go abroad and we had an emergency,
We will be covered.
yeah, there's also. So basically, comprehensive naman yung in-offer sa atin na package na family plan
Yes, definitely.
ng MaxiCare, and we're so far sa awa na naman ng Diyos, hindi pa naman namin uli nagagamit yung card.
Yeah.
Lord, oo. But at least you have your peace of mind.
Yes,
Oo.
because it's always best to invest in particular in your health. Can be expensive, can be cheap, it's up to you. You need to look your HMO.
Prevention is still better
Yes.
than cure. Alam mo, sa totoo lang, mas gusto ko pang hindi gagamitin itong mga card na. I'd rather not use the card. And
Yes, of course.
kaya, just for ano lang to. Because, you might ask pala, why can't I just pay in cash, diba?
Yeah, but as I told you before, many tao dito sa Philippines save money in case of health problem. But when you go to the hospital and the bill will reach 300, 500,000 and you spend all your saving for that, there will be really...
Mag-iisip ka na sana nag-HMO pala ako.
While if you spend maybe 10,000, 20,000 per year, and if you have a problem, they will cover you that money, you have saved a lot. Maybe you will not need. Likely, and of course we hope that we will not need, but if ever we have spent 10, 20,000 instead of maybe
Plus,
500, 600,
you know
more.
what the benefit of an HMO is? For example, emergency or admission. If you have the card, hindi ka hihingan ng deposit.
Yes.
Hindi. Kasi may card ka eh. Naka-under ka ng plan.
Mm-mm.
Kung paying client or paying patient, you will be required a hospital deposit.
Yes, and this is another also
For your
surprising things for me in the Philippines, because if you don't have the money, the hospital is not doing anything to you. It's just letting you stay there in the bed, but they will not do anything to you, right? Even if you're in really hard situation.
Bago ka gawa ng labs, bago ka gawa ng x-ray, magbabayad ka muna.
Yes, and if you don't have the money, nothing.
Paano kung, even with what happened, di ba? Especially, like, with our lifestyle before, no? We always travel, we always move, we always go to places na walang mga ATM, kukunti lang ATM. Alam mo yan, saan ka kukuha ng pera kung wala kang cash?
Yeah. With the card, you just
Credit card, ako, good luck. Like, not a lot of establishments here accept credit card, especially in far-flung areas.
Yes.
Or,
Even dito sa Puerto, I remember that when for my elbow, they didn't accept card. They accepted only cash.
we chose to have an HMO because it suits our lifestyle.
Yeah.
Diba?
And definitely, I think suit the life of everybody. It's really best to invest in your health than be sorry later on.
Well, investing in your health is, taking care of your body, like, exercise. eating the right food, taking care also of your mental health. But this is just something that will make you go to sleep at peace.
And more protected.
Yeah, in case of emergency, ganyan. Plus, I think what's good with having an HMO is, ito po, parang prepaid na. When nung na-hospital siya, wala kaming nilabas na pera.
Yeah, totally zero. We really didn't cash out anything, right?
Kasi bayad, kumbaga prepaid na eh. Nabayaran na namin yung premium, yung annual fee. I-renew ka na lang the following year. Basta, hindi mo pa nakukonsume yung annual benefit limit mo. So, for example, bakit yung sa health insurance, no? I'm not gonna discuss any further about the other kinds of insurance, but just a comparison of getting a health insurance compared to an HMO. A health insurance usually reimbursement.
Yes.
Ang mangyayari, you have to pay first, and then you fill out the documents, fill out the forms. You have to have the doctor sign. You have to have other people sign. You have to do the legwork of filling out the papers, and then submitting it to your insurance company. And you still need to wait and follow up for a reimbursement.
Yes, medyo mahirap the process, and this actually is what is happening to me.
What I don't like.
Yes, and this is what is happening to us when I had the accident for the motor.
Because we also use this health insurance.
Because in that case, we use the health insurance from Italy.
From Italy naman yon. So, yon talagang paperwork, lahat. Final ko, in-scan ko, tapos nag-fill out ako ng form. And then we had also the doctor. I also asked for some documentation from the doctors, and we had to send it to Italy.
Also doing all the translation, because of course my country was asking all the translation in Italian language.
Pa yun, diba? It's from buti nga, hindi pa panahon yun ng pandemic, lalo na ngayon, ang hirap-hirap go around, to go out and go to the hospital and see the doctor and ask for papers.
Now would be really hard.
Yeah, I mean, if I have my card, if I have my HMO, swipe lang. After that, verification, etc. Of course, the usual process. And then, pag bill out, kami naman, binibisita naman kami ng liaison officer ng MaxiCare. And I always check the running bill, so alam ko kung ang aming annual benefit limit is na-consume na or hindi. So, alam mo yun, meron kang na-monitor mo yung gastos dun sa billing nyo.
But we need to say something. The HMO and almost all the insurance doesn't cover for COVID, because we are in COVID time. Just to clarify, if you do any of these, they don't cover the COVID-19.
I'm not sure though, but I think I read that some.
Our HMO, no, I'm sure.
I'm not sure. Now,
yes.
Itong plan na to, family plan kasi to.
With that one, doesn't cover the COVID.
But it's standard kasi even before when we were still in the corporate world, I read the contract and the agreements, no. For pandemics, it's really not covered because yun nga pandemic siya.
Yeah.
So imagine na lang natin kung lahat nagkaroon ng pandemic,
the HMO will go
magko-collapse ang HMO. So understandable po yun. But I think there's special rate. But right now, the HMOs and the insurance companies are getting creative with their products. I think I read some are covering certain aspects of this COVID thing.
Well, that's very.
But not everything.
Yeah.
And the thing is, you really need to
read all
take the time to read the plan, read the agreement, go through it.
Yeah.
Like seriously, I spend time reading these things.
Yes, there are booklets, paper,
I read that.
everything.
Ilang page talagang binabasa ko to. Tapos if I'm not sure that, or if I don't understand something, I really call my agent. I really call them and ask them for clarification, because really, I mean, it's money.
Yeah.
It's also money. You spend money for these things.
And also because, be honest, if you have some expectation, you are going to the hospital because you have any problem and you are not covered by that, after you complain, but you are in fault. It's not the hospital.
Dito naman pala. Kasi meron din hindi covered.
Yeah, there is some non-covered.
Meron covered, meron naka-exclude yung mga exclusions and limitations. Ayan, meron din part na magre-reimburse ka. For example, in an area na accident ka, at wala talagang accredited na hospital in that area or ilang
You need to
kilometer
pay.
radius. So yun, magbabayad ka talaga, pero i-reimburse mo rin.
But in the Philippines, anyway, MaxiCare is really spread all over the country. So also this is one of the reasons why we got that, because we contact also other HMO. Some was a bit confusing, some was not present in Palawan. So
Tsaka hindi, what I like about MaxiCare is mabilis sumagot ang agent, ang liaison officer or the agent.
yeah.
You know, this is what I like about them. This is also my gauge in choosing an HMO, because pag hindi mo kaagad matawagan yung agent, lalo na pag emergency, di ba? Pag dun pa lang sa plan ay hindi mo na matanong, hindi hindi tayo hindi tayo magkakapirmahan yan. So, but I've worked with these guys even before in the company, and I'm at peace. I know they're very professional.
Yes.
They really answer. So.
And better being peace and protected than no. So that's it, I think.
Ito yung share namin sa inyo kung how we live our life in the Philippines. Na given the situation that the government doesn't cover, how much do you spend for this, blah 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 blah. Well, it's really about research. You know, you have to take the time to know what you will get, like what kind, even kung insurance or HMO yan. Okay, you will ask me, should I get a health insurance or an HMO? Well, I will ask you back, what do you want? Like, what do you need? What's your priority? Like, I want convenience. I want freedom to move without having to think about, if something happens, then I have to go to an ATM, or if I have to do reimbursement and have paper sign. I don't want that. Yeah. I would go for an HMO and get covered and just pay annual, rather than, or you can get both, because
also,
yeah,
if you have the money and you can.
Ngayon there's different. Marami na ngayong may VULs pa nga na ino-offer na may insurance na, tapos may kasamang investments. Pero yan po ibang usapin na, at yan bagay na dapat na inyong i-research kung kayo interesado. I read somewhere that if you wanna invest, you have to invest time in knowing what you are investing in.
This is always for everything, actually.
Kailangan talaga basahin nyo yan. Because I've also read yung mga proposals and plans for other insurances, traditional, variable, talagang makapal yan. But you have to know, you have to understand, you have to ask the question. Here, we are only sharing with you our HMO, that na talagang kami naman in-experience talaga namin na hindi naman kami napabayaan ng HMO namin.
Yes.
Yun. So now, the delivery, the birth ni baby ay hindi covered. So ito po talagang paghahandaan namin. And naman, so far we had the last check-up. Okay naman siya.
Yeah, the baby is fine. Look at here. The tummy is fine. And everything is going smooth. Hope that in this video we have answered to many of the questions that you asked, guys. And it's everything for today. See you tomorrow. Ciao, ciao.
Ciao. We are Mirco and Tere, an Italian and Filipino couple who loves to travel and explore. Welcome to our channel.
I sat down by the ocean. It's that tears that I feel.